Normal colonoscopy, normal CT scan, normal endoscopy, normal ultrasound, normal stool test. And then your doctor tells you everything is normal, so you have IBS. If that is your story, I need you to hear this. Normal does not mean that everything is normal. It means nothing is wrong that those tests were meant to find. And there's a very big difference. In the next few minutes, I'm going to share with you why IBS won't go away, and even if it does for a short amount of time, why it keeps coming back, and what actually has to happen for it to stop. This is not generic gut health advice. These are the things I have learned after more than a decade in gastroenterology, treating hundreds of women with IBS. You've tried elimination diets, Imodium, probiotics, supplements someone on the internet recommended, yet your life still revolves around the bathroom. You've done all of the testing your gastroenterologist suggested, and then you were told everything is fine. You just have IBS. That is probably one of the most demoralizing parts of it, because it is not just IBS. IBS is life-altering. In the patients that I have treated and the clients that I have seen, IBS can take over their entire life. Some women cannot even go to work. They cannot socialize. They cannot travel. That is not just IBS. And when you tell someone like that to just take Imodium, it is incredibly demoralizing because you know that that is not going to fix it. I'm Aneliya. I'm a board-certified physician assistant. With 11 years in gastroenterology, I've helped hundreds of women recover from IBS, initially treating them in conventional medicine where I watched us fail them, and now in my own practice where we actually get to heal. I know why nothing has worked yet, and I know what does. The people who ends up being stuck are the people who are treating their triggers. The people who heal are treating the cause. I'm going to show you 4 reasons IBS will not go away and exactly what needs to happen in your body for things to shift. Number 1, your doctor's tests are meant to rule out cancer. They're not meant to tell us why you have IBS. Testing like a colonoscopy is meant to rule out, screen for, or prevent colon cancer. Although very important, this has nothing to do with trying to treat your IBS. Every person should have their colonoscopy starting at age 45 and then every 5 to 10 years after, depending on your risk factors. That is to screen and prevent colon cancer. Incredibly important. But once you have had that test and you are dealing with chronic gut health issues, that test will not show us anything about the imbalances inside of your gut. Being told that everything is normal means that you simply do not have cancer. It does not mean that you do not have an imbalance in the GI tract. The test came back normal because you had the right test for the wrong problem. I spent 11 years in gastroenterology watching this happen multiple times. You would have the testing done, you were told everything is normal, and in the case of IBS with diarrhea, you're given Imodium and maybe some antispasmodics, perhaps the FODMAP diet, and sent on your way. Months later, these people will come back in, most of the times worse, and at a complete loss as to why they're still having their symptoms. The reason why they're still having their symptoms is because the investigation was never done. It just looked like it was. So if conventional medicine misses the cause, then what testing actually finds it? The real drivers of IBS are identifiable only if someone actually looks for them. Across hundreds of patients that I have dealt with IBS, there are specific patterns that actually trigger those symptoms. Number 1, we need to look at your digestive function. How is your stomach acid, pancreatic, and biliary function? Then we need to evaluate your microbiome. How is the good bacteria in your intestines? Is there enough of the good? Is there sometimes too many of certain bacteria that leads to inflammation? Are there any opportunistic infections? And I'm not talking about the ones that cause acute diarrhea like C. diff, Salmonella, and E. coli, etc. I'm talking about the things that give you chronic gut issues, things that may be living in the small intestine or even in the stomach. We're talking bacteria, parasites, worms, fungus like Candida. Do you have compromised gut lining? And if you do, what is the cause of that compromised gut lining? And for those who think that they have tried everything, you haven't. If you have not been evaluated in the correct way, you have not tried everything because you never even had the right testing. Ask yourself these 3 questions. Do you know the specific cause of your IBS, or do you only have the label itself? Have you ever had comprehensive stool testing to evaluate for the entire function of the GI tract? Do your symptoms follow a pattern, or do they seem random and unpredictable? If you answered no, no, and unpredictable, you have not had real investigation. You had a cancer screen. Now here's where it gets really frustrating. The things that most people try once they get their diagnosis can actually make your symptoms worse, not better. Things like an elimination diet, for example, can make your symptoms worse, not better, if done alone without a healing protocol. An elimination diet, like the FODMAP diet, which is the most common diet given to patients with IBS, takes out many foods, which most of them are plants. Plants are the only things on the planet that have fiber, and fiber is what feeds your microbiome, the good bacteria that balances your gut. If you limit the microbiome's food, you will limit the diversity of the microbiome. That in turn will cause more imbalances and more leaky gut. More leaky gut causes more food sensitivities. So when you've done this for years, you end up with 5 safe foods that you can eat, and your food sensitivities have gotten worse and worse over time. Ask yourself this question: if the list of safe foods that you have has gotten shorter and shorter over time, you are not healing, you are covering up a problem that needs to be addressed. So what does the right approach look like? This is where most practitioners and most clients get things very wrong. If this is making sense and you're realizing you've been stuck in the wrong approach, hit the subscribe button. I release videos every week helping you understand what is actually going on with your gut and helping you fix it. Now, let's talk about what healing actually requires, because the sequence matters more than most people realize. Healing IBS requires a specific sequence: evaluate, eliminate, and elevate. Evaluate is where testing comes in. You need to have the right testing to understand the imbalances that are driving your symptoms. What are the causes of your triggers, not just your triggers? Eliminate. We need to eliminate the pathogens that are causing havoc in your intestines. We need to make sure we eliminate the imbalances instead of making choices based on fear. And elevate. We need to restore your digestive function, restore your microbiome, and heal your gut lining. I'll tell you about one of my clients, Jess, who is a school bus driver. She was very close to losing her job because you cannot be on a school bus and stop for a bathroom break. Within 2 weeks of starting work with me, her diarrhea and urgency completely stopped. This is not because I threw random supplements at her. This is because we did the right testing. We found where the imbalances were. We directed care at every level that is out of balance. And healing happens every single time. She's now able to go out to dinner with her husband and eat a salad, which used to send her to the bathroom for about an hour prior to working with me. Now she's able to enjoy food freely. She's able to work without being fearful of losing her job, and she's able to travel and see her family without having to restrict herself during the trip. This is what healing is. It is not restriction, and it is not band-aids. Write down whether you know the cause of your IBS or only your triggers. Triggers are foods or stressors that aggravate symptoms. Causes are the underlying imbalances themselves. If you can list triggers but not your causes, you have not had a full investigation yet. You have just been managing. That is the starting point, not a new diet, not a new probiotic, real investigation. IBS is not a mystery. Your body went out of balance for a reason. There are imbalances on the inside triggering your symptoms. To be able to stop IBS, it is to find those imbalances through the right testing, the right investigation, and then the right protocol built based on those tests. You are not out of options. You just have not had the right investigation yet. Now, here's something that may surprise you. A lot of the healthy habits that you were told to do may actually be making symptoms worse. I made a video explaining exactly why a clean diet may actually be destroying your gut and what to do instead. That's the video to watch right now. It's linked on your screen right now.